Suicide is a difficult topic, but an important one. In Ohio, about 5 people die by suicide each day. I'm joined by Dr. Tom Lehner from Buckeye Health Plan to talk about warning signs and how to help. Thank you so much for being here today.
Happy to be here.
Very difficult topic, very important one though. What are some of the warning signs that someone may be struggling?
You know, they're variable, but I always tell people look for a change in somebody's common behaviors. Things like they may become less engaged with family and friends. They kind of dissociate themselves from those people. Increased moodiness or irritability, sadness or depression, comments like, I'm helpless, I feel helpless, they feel hopeless, or like they're a burden to someone or to many people. Changes from behaviors like they used to go for a walk, or they used to like to watch a certain TV program. They don't do those things that are pleasurable anymore. I would also say that if somebody talks about dying or hurting themselves, that needs immediate action.
And what do you do if you notice these signs?
The first thing I would suggest people do is ask the question, are you okay? Is there something wrong? I've noticed something different. That'll help get the conversation started. There's no right or wrong answer. It's getting them engaged to talk with you. But let them know that you're there to listen to them and support them and help them. I would gently encourage them to get help, and using the 988 call service would be a very beneficial thing. You can't fix it, so don't try to fix it, but I would suggest that you just let them know you're here to listen and be supportive to them.
What if someone is struggling and doesn't want help?
That can mean a couple of things.
Okay.
Sometimes it means that they are just so overwhelmed that they don't want help, but I would stay encouraged with them and encourage them to talk with you, and that you let them know you're available to listen and to be supportive, and that they're important to you. Sometimes it indicates that they have already developed a plan and that they're waiting for an opportunity to execute the plan. So that's kind of a judgment call, but I would think if there's any doubt in your mind that this is an emergent situation, you need to reach out for emergency services or encourage them to call the 988, or you can call or text 988. But I would think that, you know, staying engaged and let them know that you care about them is very, very important.
What if someone is personally, maybe they're watching right now, experiencing those suicidal thoughts? What should they do?
It's a very lonely feeling. And so you don't have to do this by yourself. There's help out there. And we have in Ohio the Suicide Prevention and Crisis Lifeline. You can text or call 988. It's available 24 hours, 7 days a week. It's free, it's confidential, and all you need to do is text or call 988. And you'll be connected with a professional counselor that can help you with your current situation, especially if it's an acute or urgent situation, and then direct you to the right resources that you can get help and get through this difficult time.
How does Buckeye Health Plan help support members who are struggling?
Members of Buckeye, they can take advantage of the Buckeye support line, a member support line. They have a lot of resources available, mental health providers, counselors, opportunities for medical therapy or medication if necessary. Also on the website, there's a whole bunch of resources you can take advantage of.
What do you want our viewers to take away from this today?
You know, suicide is a very difficult topic. I would say that we all know somebody who's lost their life to suicide. So don't be afraid to ask the question. There's no wrong question to ask. Let them know that you're there to help them and be supportive. And that life's worth living, and that you want to be there for them to help. Encourage them to get help with the 988 calls or reach out to their medical provider, but be there for them. It's important to know that for them to know that they're not alone.
Absolutely. Life is worth living. Dr. Lehner, thank you so much for joining us today.
Thank you. It was a pleasure.
If you or someone you know needs help, call or text 988 to connect with the Suicide and Crisis Lifeline, or visit 988lifeline.org. And please remember that you are not alone. We'll be right back.